Now we will discuss about the blood supply of heart. See, before going to study about the blood supply of heart, you should know what is aortic sinus. See here, we cut the aorta here and I am opening the aorta. You can see semilunar valves very clearly. This is semilunar valve. Semilunar valve contains three cusps: anterior cusp, right posterior cusp, left posterior cusp. Just above these valves, you can see some dilatation. That dilatation what we are calling aortic sinus. Dilatation above these valves, what we are calling aortic sinus. This sinus what we are calling aortic sinus. From that aortic sinus only, right coronary artery and left coronary arteries are arising. Right coronary artery and left coronary arteries are arising from that sinus only. Here, one important MCQ is all parts of our body supplied during systole of the heart. The only organ which is present in our body supplied during diastole. During diastole it will be supplied. Why? Imagine here aortic sinus is there. From here arteries are coming. Okay? Here valves are present. Here valves are present. During systole, valves will be opening so that blood will be pushing through the aorta. That time arteries will not fill because blood is going through the aorta. But during diastole, semilunar valves will be closed. When the semilunar valves are closed, just above the semilunar valves, there is a dilatation. Here it is filled with blood. This sinus is filled with blood. Now this blood enters through these arteries. So heart supplied during diastole. Understood the concept? So here, this is the right coronary artery. This is right coronary artery taking origin from the anterior aortic sinus. It is arising from the anterior aortic sinus. See, this is anterior aortic sinus. Okay. Actually, aortic sinus will be divided into three sinuses. How? Three leaflets are there. Okay. The sinus which is present above the anterior cusp, that sinus what we are calling anterior coronary sinus. If it is present over the left posterior cusp, that is left posterior sinus. If it is present over the right posterior cusp, that sinus what we are calling right posterior sinus. So these are three sinuses are present here. So from the anterior aortic sinus, this artery is arising. What is this artery? Right coronary artery. And if you observe left side, this is left side, no? Okay. This is left side, right? So from the left posterior aortic sinus, left coronary artery is arising. This is left coronary artery. Is it? So these are the two arteries which are arising from the aortic sinuses. But one sinus is remaining. What is it? Coronary sinus. Right posterior is remaining. That sinus, what we are calling non-coronary sinus, because it is not giving any origin to the coronary artery. So that's what that is non-coronary sinus. So three coronary sinuses are there: anterior coronary sinus, left posterior coronary sinus. These are giving origin to the right and left coronary arteries. But the right posterior is not giving origin to the artery. That is non-coronary sinus. Non-coronary sinus. Right? Then blood supply we will discuss here. This is right coronary artery. It is taking origin from the anterior aortic sinus. Then it runs downwards obliquely within the groove. What is this groove? Right anterior part of atrioventricular groove or coronary sulcus. And it is present in between the pulmonary trunk and right auricle. Okay. So first it is taking origin from the aortic sinus. Then it is present in between the right auricle and pulmonary trunk. Then descends downwards towards the right side obliquely within the right anterior part of coronary sulcus. Then it winds around the inferior border and enters into the posterior part of coronary sulcus. See here, it is entering into the posterior part of coronary sulcus. Then here, this is branch, this is the continuation. This is branch of it, even though it is very large, but this is the continuation. Okay, it crosses the crux of heart. Is it or not? I have told you. It crosses the crux of heart and it anastomoses with the circumflex artery. This is circumflex artery. This is circumflex artery. Circumflex artery is branched from the left coronary artery. So this continuation of right coronary artery, see here, this is continuation of right coronary artery. Anastomosing with the circumflex artery. See, this is circumflex artery. This is circumflex artery here. So it will be terminated after anastomosing with the circumflex artery. Is it? Very simple. Recollect. It is taking origin from the aortic sinus, runs in between the right auricle and pulmonary trunk. It runs in the right anterior part of coronary sulcus. Then it enters into the posterior part of the coronary sulcus and it crosses the crux of heart, anastomoses with the circumflex artery of left coronary artery and it will be terminated. This is the course. Is it clear? Then, what are the branches? What are the branches of it? If you observe here, there will be some branches towards the atrium. See here, these are the branches which are supplying to the atrium. These are atrial branches. These are the branches which are going towards the ventricle. So these are ventricular branches. So these are ventricular rami. These are atrial rami. Right? The first ventricular rami, see here, this is first ventricular rami, is supplying to the infundibulum of right ventricle. So this artery is what we are calling conus artery. What is it? Conus. Conus artery. Usually circumflex artery also will give one conus artery to supply the infundibulum of right ventricle. So both will be anastomosing here. That anastomosing pattern, it is looking like necklace of infundibulum. So that arrangement what we are calling annulus of Wiesen's. Annulus of Wiesen's. Annulus of Wiesen's. Sometimes this right conus artery. Actually here right conus artery and left conus artery. Anastomosing and forms the necklace. That necklace what we are calling annulus of Wiesen's. Sometimes this right conus artery directly arising from the aorta. Directly arising from the aortic sinus. That artery we can also call as third coronary artery. Third. It is third coronary artery. Is it? So that is the worth mentioning artery here. Then one more worth mentioning artery here is marginal artery. See here, this is the artery which is present along the inferior border. So this artery what we are calling right marginal artery. This is right marginal artery. Okay. Remaining ventricular branches will supply to the ventricles. Then here branches towards the atria. These are atrial branches. In these atrial branches, the important branch which is worth mentioning is the branch which is supplying to the SA node. The branch which is supplying to the SA node, that will be passing in between the aorta and the right auricle and it arches over the superior vena cava and descends down and passes through the central axis of the SA node and it will be supplying. Simply remember that first atrial branch will supply to the SA node. Remaining atrial branches will supply to the right atrium. This is about the proximal segment of the right coronary artery. Then if you go posterior aspect, in the posterior aspect also it will give some ventricular branches to supply the ventricles, some atrial branches to supply the atria. Is it? The important branch is this branch, posterior interventricular artery. Posterior interventricular artery. This posterior interventricular artery runs in the posterior interventricular groove and anastomoses with the anterior interventricular artery. Anterior interventricular artery is branched from the left coronary artery, that you will see, where at the junction of anterior 1/3 and posterior 2/3, at this part there will be anastomosing between the posterior interventricular artery and anterior interventricular artery. This posterior interventricular artery will give ventricular branches here. This side also it will give, this side also it will give. So it is not only supplying to the right ventricle, it is also supplying to the left ventricle strip along the posterior interventricular groove. So at this part also posterior interventricular artery is supplying. Not only this part, this small portion also supplied by posterior interventricular artery, that is branched from the right coronary artery. This posterior interventricular artery, it is supplying to the interventricular septum also. Interventricular septum will be like this. From here arteries are entering into the septum and it supplies to the posterior two-third of interventricular septum. So, posterior two-third of interventricular septum supplied by posterior interventricular artery, that is branch from the right coronary artery, whereas anterior one-third of interventricular septum supplied by anterior interventricular artery, that is branch from the left coronary artery. Now concludedly, if you say right coronary artery supplying to the right atrium, right ventricle, except strip along the anterior interventricular group. See here, this strip will not be supplied by right coronary artery because this artery will be supplying here. Anterior interventricular artery is branch from the left coronary artery. So this branch will be supplying at this part. So right coronary artery supplying to right atrium, right ventricle, except strip along the anterior interventricular groove. And it also supplying to the left ventricle, strip along the posterior interventricular groove. Strip along the posterior interventricular groove. Because this is branch from the right coronary artery. It is supplying this side also, this side also. So strip along the posterior interventricular groove. That means left ventricle strip along the posterior interventricular groove. This area supplied by right coronary artery. Along with that, total conducting system except left bundle of his. Total conducting system except left bundle of his supplied by right coronary artery. Then here you have to tell about the dominance. See here, posterior interventricular artery is branch from the right coronary artery. Sometimes this branch will be branch from the left coronary artery. That time it is left dominant. This is posterior interventricular artery. Is branch from the right coronary artery. In this case, this heart is right dominant. Sometimes circumflex artery is coming like this, no? That will give posterior interventricular artery. That time that heart will be the left dominant. So dominancy of heart is depends on the posterior interventricular artery. If the posterior interventricular artery is branch from the right coronary artery, that is right dominance. If it is branch from the left coronary artery, that is left dominance. Sometimes in some individuals, both arteries will give branch. That is balanced. That is about the right coronary artery. Then coming to the left coronary artery, we will make it simple. See, this is the left coronary artery trunk. This left coronary artery is taking origin from the left posterior aortic sinus. Left posterior aortic sinus. After taking origin, it runs in between the left auricle and pulmonary trunk. Okay. Then it enters into left anterior coronary sulcus. Left anterior coronary sulcus or left anterior part of coronary sulcus. There it will be dividing into, see here, this is anterior descending artery. This is anterior descending artery. We can also call it as anterior interventricular artery. This is anterior interventricular artery. Is it? Then circumflex artery. This is circumflex artery. This is circumflex artery. This is anterior interventricular artery. First we will discuss about the circumflex artery. Circumflex artery enters into the left anterior part of the coronary sulcus. Then it winds around the left border and it enters into the posterior part of the coronary sulcus, and here it is anastomosing with the main continuation of right coronary artery and it will be terminated. So this is about the circumflex artery. Then what is this? This is anterior interventricular artery. This anterior interventricular artery descends down in the anterior interventricular sulcus and it passes through the incisura epicis cordis and enters into the diaphragmatic surface, anastomosed with this artery. What is this? Posterior interventricular artery. So here anterior interventricular artery and the posterior interventricular arteries are anastomosed. This is the anterior interventricular artery. Now we will see what are the important branches. See here. This is diagonal artery. Diagonal artery. This diagonal artery is branched from the anterior interventricular artery. It runs towards the apex and supplies to the ventricle. This one. Right? Then from the circumflex artery runs along the left border. This is left marginal artery. This is left marginal artery. This left marginal artery is branched from the circumflex artery. It runs along the left border. This anterior interventricular artery will give branches right side and left side. So ventricular branches supplies to the ventricles. So these are the different branches from the left coronary artery. Now how it will be supplying? Right coronary artery separate right atrium, right ventricle, except the strip along the anterior interventricular sulcus, and supplying to the left ventricle strip along the posterior interventricular sulcus. But if you coming to the left coronary artery, it is supplying to the left atrium, left auricle, left ventricle, except strip along the posterior interventricular groove. Strip along the posterior interventricular groove, it has been already supplied by right coronary artery. That's why it is not supplying. So left coronary artery supplying to the left atrium, left ventricle, except strip along the posterior interventricular groove, and right ventricle strip along the anterior interventricular groove, because this area will be supplied by anterior interventricular artery. So this area of the right ventricle is supplied by left coronary artery. Along with that, interventricular septum. Interventricular septum, which part? Posterior 2/3 already supplied. Now anterior 1/3. Anterior 1/3 is supplied by anterior interventricular artery, that is branch from the left coronary artery. So this is how blood supply will be happen to the heart. Then venous drainage, I will tell you very simply. See, this is coronary sinus. You know that this is coronary sinus opening. This is coronary sinus opening. This is coronary sinus here. Okay. This coronary sinus is around 3 to 4 centimeters length. It is present in the posterior part of the coronary sulcus. We know that it is opening into the right atrium and it is guarded by Thebetian wall. Now, what are the tributaries of it? Into it, what veins will be opening? See here. This is anterior interventricular sulcus. Within the anterior interventricular sulcus, one vein will be there. That vein is great cardiac vein. That great cardiac vein runs within this groove and enters into left anterior part of coronary sulcus. So course will be like this. See here. It will be going like this. Then it enters into the left anterior part of coronary sulcus. Then it winds around the left border and it is opening into the coronary sinus. This vein, what we are calling great cardiac vein. This is great cardiac vein. Then middle cardiac vein. See here, what you are seeing is middle cardiac vein. This middle cardiac vein is present in the diaphragmatic surface in between the two ventricles. That is, it is present in the posterior interventricular sulcus, opening into the coronary sinus. So this is middle cardiac. This is great cardiac. Then small cardiac vein. This is small cardiac vein, which is present in the right part of coronary sulcus. Right part of coronary sulcus, and it will open into the right part of coronary sinus. From here it comes down, it opens into coronary sinus. Here coronary sinus is there. So it comes like this and it opens. Right? And along with marginal artery, right marginal vein also present. That right marginal vein will be opening into the small cardiac vein. Right marginal vein opens into small cardiac vein. But if you observe in the left side, left marginal vein opens into great cardiac vein. Left marginal vein opens into great cardiac vein. Right? Along with this great cardiac vein, middle cardiac vein and small cardiac vein, there will be two more extra veins. One is for the left atrium, another is for the left ventricle. So the vein of the left atrium is oblique vein of left atrium. Oblique vein of left atrium. From left atrium, it is draining, opens into coronary sinus. Then posterior vein of left ventricle. Posterior vein of left ventricle, that will be opening to coronary sinus. So for left side of heart, two veins are extra. One is oblique vein of left atrium, another one is posterior vein of left ventricle. Okay. Then some other veins also there. Those veins are anterior cardiac veins. Those anterior cardiac veins, they are not opening into the coronary sinus. They will be directly opening into the right atrium. Is it? So this is about the venous drainage.